Welcome everyone to today's BPrep Patient Forum. This is an annual event and we are excited to wrap up Breast Cancer Awareness Month with our forum this morning. So before we get started, just to jump in on a few housekeeping items here. So our panelists are all here this morning and ready to share their expertise with you. They will be off camera while each individual speaker is talking. They'll come on when it's their turn. We will have question and answers after each speaker, and I will be monitoring the chat throughout the session. So please use the chat to put your questions in, and we'll try to answer as many of them as we can. Attendees, you are all on mute, so we won't be able to hear you, but again, please place your questions into the chat. The session will be recorded this morning and the videos will be posted on our website. Usually takes us a couple of weeks to get them up after the event, but they will be available for you. And any questions that we don't get to this morning, we will also try to provide the questions and answers back to you in the form in our newsletters. We are looking forward to getting started. So we have a wonderful lineup for you this morning, a nice agenda, and Olivia has sent this to you many times. I will walk through each one of our speakers here. But before we do that, I just want to introduce you to the Comprehensive Breast Center at the Brigham and Women's Hospital and the BPrep program. So in our Comprehensive Breast Center, we evaluate patients with non-specific or non-cancerous breast complaints, such as pain, lumps, etc. We facilitate women to complete their workup if they have abnormal breast imaging or non-specific biopsy results. Of course, what we're here to talk about this morning is evaluation and education for patients who are at increased risk for breast cancer or want to learn about their risk for breast cancer. And we also are happy to evaluate and educate women on what it means to have dense breasts and to provide recommendations for surveillance. And we want to not only educate and help each one of our patients, but we also want to learn from each one of our patients. And so we do strive to have opportunities for our patients to participate in clinical trials focused on risk reduction and prevention. And you'll hear about some of those opportunities this morning in the session. So again, anybody can come to the Comprehensive Breast Health Center, whatever your complaint or whatever your need is. Everybody undergoes a standardized risk assessment. Of course, if there is a breast complaint, that's evaluated by a member of our clinical team. And women who are determined to be at elevated risk for breast cancer are then offered the opportunity to stay in our program and again to participate in opportunities for risk reduction and prevention. And women who are found to be at average risk or standard risk are referred back to their primary care teams for ongoing surveillance. Our team is very multidisciplinary. This is just a little picture to really emphasize that our team is very patient focused. Patients are at the center of everything that we do. Our team is composed of medical oncologists, surgeons, primary care physician, imaging experts, patient navigator, physician's assistants, and we work very closely with our breast imaging colleagues as well as our colleagues in genetics and prevention and the weight management group. As we'll hear this morning, we're learning more and more about lifestyle factors and how that contributes to breast cancer risk. This is our team. I'm proud to say that I think each year when we host this event, this slide has more and more pictures on it. Our team continues to grow. I'd like to highlight the folks in this middle row here. This is our amazing team of physician's assistants and our nurse that really keep the clinic going every day. Do a wonderful job caring for our patients. And then of course, along the bottom, this is our administrative staff and our research staff. And again, we couldn't do anything that we couldn't do any of this work without this staff really supporting our programs in the clinic. So shout out to everyone. Thank you for all of the hard work. So let's just start with a little bit of what I like to call Breast 101. So what is breast cancer? Well, cancer in itself is a group of diseases characterized by uncontrolled growth and spread of abnormal cells. And so when we think about breast cancer, we see the picture here. So the breast tissue is essentially made up of milk glands, which we call lobules, and milk ducts all going to the nipple for breastfeeding. And in the normal duct, you can see that duct would just be lined by a single row of cells, all very uniform, same size, same shape. And for whatever reason, when a breast cancer starts, one of these cells goes bad. That one bad cell divides into two bad cells, those two continue to divide, and so on. And then you get to something like we see in the middle panel here, where we have all of these abnormal cells contained inside this milk duct. And this is what we would call pre-invasive cancer, or duct carcinoma in situ, intraductal cancer. All of those names that you may have heard represent this early phase of breast cancer, where the cells are still confined within the milk duct. And then when those cells can break through the wall of the milk duct and get out into the fatty tissue of the breast, that's when we call it invasive breast cancer. So what does it mean to be at increased risk for breast cancer? Well, it means that your chance of developing breast cancer is higher than the average woman. And we know the average woman in the United States has a 12% lifetime risk of developing breast cancer. So that means 12 out of 100 women, depicted here by the pink women in our graphic. This is the woman's average lifetime risk for developing breast cancer. So women who are at elevated risk have a risk that is, higher than this. We know a lot about risk factors for breast cancer. You're familiar with the questions that you're asked when you go into for your visits, and we're going to talk more about this during the course of the morning. But what we're learning more and more about is actually lifestyle factors that are associated with breast cancer risk. And one of the most important lifestyle factors is, in fact, obesity and exercise. And we know that over 1 in 3 adults struggle with weight, and particularly postmenopausal weight gain when we're talking about our female population. And only 1 in 4 adults actually meet physical activity guidelines. Alcohol is becoming increasingly important as a risk factor for developing not only breast cancer, but other cancers. For women, drinking more than 1 drink per day is associated with an increased risk. Again, obesity increases risk of postmenopausal breast cancer, and exercise is associated with a reduction in risk. And we know there is a dose-dependent effect whereby women and men who exercise more have a lower risk of developing cancer. We've talked about the role of diet in breast cancer prevention and survival at this symposium previously. I just shout out here to Dr. Eliason, who's not with us this morning, but she has a wonderful video that you can find online on our website talking about the role of diet in breast cancer prevention and survival. And this morning, we're going to hear more about the role of exercise in breast cancer risk and risk reduction. I mentioned that one of the things that we like to do is offer our patients the opportunity to participate in clinical trials and efforts to help us learn more about risk reduction. And Dr. Ligabel ran a clinical trial looking at the benefits of exercise in our clinic several years ago. And again, in 2019, we had a participant in the forum, Mil Neopold, who was actually one of our patients and was actually the first participant in Dr. Ligabel's clinical trial looking at the impact of exercise. And again, Mil has a nice video on our website, really highlighting the impact that participating in this clinical trial and participating in our program had on her personally. Again, we do have other resources around exercise on the website. Again, we know that physical activity reduces breast cancer risk in both pre- and postmenopausal women. Exercise likely helps through a variety of mechanisms, lowering the levels of sex hormones, preventing high blood levels of insulin, reducing inflammation, and improving immune system function. And I'm sure that Jennifer is going to speak more about this morning. But again, just highlighting the resources that we do have available to you both in our clinic and on our website. Also on our website, you'll find several small snippets of exercise demos, things that you can do just in 15 or 20 minutes on your coffee break or in the evening when you get home. Very simple exercises to get you moving and to help putting those words into action. We'll also hear this morning from Mary Beth Hans. She is the clinical director of our BPREP program, and we work very closely together to ensure that we're doing the right things for all of our patients. She'll talk about the anatomy of a risk assessment. Why do we ask the questions that we do? Again, You've all been asked your age at menses, your age at menopause, about your childbearing, exposure to radiation, previous breast biopsies. All of these factors are important because they help us to try to estimate your risk of developing breast cancer. We put all of those factors into our risk models, which again help us to categorize women into low risk, average risk, and high risk. Helps us to identify women who may be eligible for risk reducing strategies such as medications. Helps us to find women who might be eligible for our research studies, and helps us to identify women who may be eligible for increased surveillance. What can we be doing in addition to mammography for women who are at higher risk? But these models are really just the first step, and we know that they're not perfect. So this morning, we're also going to hear from Dr. Lehman, one of our friends and colleagues and a radiologist at Mass General Hospital, who's going to share with us her future vision for personalized risk assessment and screening. And I know that's going to be a wonderful talk. We'll also hear from Dr. Judy Garber, the chief of the Division of Cancer Genetics and Prevention here at Dana-Farber this morning. She'll talk to us a little bit about breast cancer genetics. What do we mean when we say genetic breast cancer or inherited risk? Well, we all have the same genes, about 25,000 of them, but there are certain genes that are associated with cancer risk. And these genes, particularly their job, their normal function is to protect cells from becoming cancerous. So in that early graphic, when I said that one cell goes bad for whatever reason, divides into two bad cells, and those two continue to divide, the genes that are associated with cancer risk, their job is to stop that process from happening. We inherit one copy of each of these genes from our parents, and if one copy is bad or doesn't work as well as it's supposed to, then that patient will be at higher risk for developing breast cancer. And again, we'll hear from Dr. Garber later this morning. Genetic counselors can help women to understand whether they are at genetic risk or elevated risk based on genetic factors. Genetic counselors, again, review your personal and family history. They'll discuss the benefits and limitations of testing, help to decide if you should in fact be tested, and then interpret those results. And again, we're fortunate here at Dana-Farber to have support from our colleagues in clinical genetics and prevention. But if you're joining us from beyond Boston, just a little note here at the bottom, you can find a genetic counselor at www.nsgc.org. Clinical research, again, Dr. Garber will talk to you about some of these opportunities. So what is clinical research? Well, clinical research is research that's conducted with human subjects, so people like us, usually to answer questions about diseases, biology, behavior, and the effectiveness and or the side effects of the strategies that are intended to prevent or cure those diseases. And again, our focus in BPREP is really to bring you opportunities to participate in research to prevent or to reduce the risk of developing breast cancer. And finally, we have two new participants in our forum this morning, which we are really excited to hear about. We have Dr. Susan Hellerstein, who is the founder of the New Cook program, and Laura Klein, who is a faculty of the Chef Coaching program and the owner of Well Seasoned Coaching. And I know that you all have went out and purchased all the ingredients that you'll need to work along with Laura this morning as she demonstrates how to cook these wonderful, very enticing looking snacks and lunch for us this morning. So again, we're very happy to have Susan and Laura joining us for the first time in the BPREP program. So without further ado, we will jump in. Again, we're glad to have you all here with us this morning. Please put your questions into the chat and we will try to answer as many of them as we can.